Post-traumatic stress disorder is more commonly experienced from childhood abuse of a physical, emotional, or sexual nature that occurs in dysfunctional families than with people who have gone through one single major trauma, such as the Oklahoma bombing. Therefore, it is important to discuss how PTSD can develop in dysfunctional families and how that differs from the experience of functional families. This part of the discussion is based on work by Patrick Carnes, Wayne Kritzberg, and Robert Firestone, as well as my own experience in the field. These men are leaders in the fields of sexual abuse, addiction, and chronic shock. Consider what happens in a healthy family. The child is in homeostasis or balance. They feel good about themselves and nothing is untoward. However, a shocking event occurs which disrupts the three brains and the body. The child goes into shock, the feelings shut down, and there is disequilibrium because of the trauma. After the shock has dissipated, the rebound stage begins, in which the feelings resurface, allowing the person to become aware of the emotions that are present. Next is the resolution stage. This is the stage where it is important to express and resolve the emotions associated with the trauma, and which reestablishes equilibrium. Since sharing is possible in a healthy family, the family discusses the shock and the child's reaction to it, and provides support while the child emotes the feelings. This allows the child to resolve the trauma more quickly and actually grow from the experience. In contrast, imagine a family that is dysfunctional, sitting at dinner. There are two girls, a father and a mother, and the parents are talking. Suddenly, the father leans over and slaps the mother in the face. When trauma and shock occur in these types of families, everyone maintains silence. No one would talk, everyone would freeze. That leaves the children to interpret what the trauma means. And because children are egocentric, it always has to do with them. They are going to view themselves as the cause of the problem, even when they know better. They might believe they caused it to happen, or they should have been able to stop it, or they should have been able to take care of the situation after it happened. It doesn't matter that there is no basis in reality for this interpretation, because that is how children reason, according to their level of development. Usually in this kind of family, Dad would order the kids to go to their rooms. The kids might sit together, probably not talking, but trying to figure out individually just what had happened. The family remains disorganized. No one really shares. There's an emotional shutdown, and people are unable to talk in or outside the family due to the fear and shame of what has occurred. This is reinforced by the dysfunctional rules dictating that people really can't talk about the situation. This is secondary abuse. It results in unresolved shock or chronic shock, where part of the brain's gates remain closed and there is actual toxicity in the body that can be dislodged only through a combination of treatment modalities, including intellectual processing and mind-body work. What would be ideal, of course, is a healthy, functional family reaction. What would occur in this type of a model is the family would talk about what had happened. and the caretaker or caretakers would explain it in a way that would make some sense. Strategies would be developed to make sure that it never occurred again. Family love and support would be shown. Counseling would be instituted. Most importantly, there would be an appropriate emotional discharge from all the family members to enable everyone to return to homeostasis. Communicating about the issue will help, but if there's an emotional blockage in the second and third brain, as well as in the body, then the primitive reaction must be dealt with by working through the issue symbolically and by going back and talking with someone in a rational way afterwards from the cerebral cortex. Often with PTSD, a minor affront in the present can trigger an earlier trauma. It is important to resolve this past trauma emotionally before confronting the present issue. In a healthy family, there's a discharge of emotion that occurs, and that enables the integration of the trauma into life and a real resolution to the problem. Often one tends to grow and develop even more by some of the traumas that happen, but only if there's a sense that something's going to change to prevent future traumas. However, if people are going to be hit like that, if there is no control over life, then they will tend to shut down and stay chronically shocked. And that's one of the things that happened to many people because of the events of September 11th, 2001. There are certain symptoms of dissociation or chronic shock that most people do not realize. These symptoms and the actual memory of the abuse can sleep for years. If someone has been sexually abused at age 10, they might suddenly remember that at age 35. Most of our processes are very subconscious. Luckily, our subconscious is helpful most of the time, and its motivation is always to be useful.